So I'd like her to tell us a little bit about what her business is all about, who she is, and then we're going to chat about what it would be like to be a patient here and who is the patient who would best be benefiting from the olive branch. You're on, honey. We're friends already, Franklin.
How are you, Franklin? PJ and I we're like girls. We're like old girlfriends. Absolutely. It's such a pleasure to have this dream of mine to come to fruition. I'm excited about all that it will bring to Franklin. We're here at 220 Davison Avenue. We're on the fourth floor in this beautiful suite. We are a primary care with an urgent care component to our services. So we will be able to provide care to people with acute respiratory conditions, acute minor injuries, sprains, strains. If there's anyone that's in need of a physical, sports physical, for our athletes out there, go Franklin. You can definitely come here. I'll be happy to take care of you. Anyone who's looking for a holistic approach, we'll be having some holistic aspects to the services that we'll be providing. And anyone who's just in need of a provider who really will take time with them and who is invested in the overall well-being of the patients.
Well, that's the wellness concept.
Yes.
That's not just I got a boo-boo, I got to find a doctor. It's the approach to the entire patient, and it sounds you are such a soothing presence that no matter what your malady is, Franklin, you're going to feel welcome here. You're going to feel like you have found somebody who's going to hear what your situation is and help you.
Absolutely. And I believe, as a nurse practitioner with over 22 years of nursing experience, that is something that I really take to heart. And I try to make sure that my patients feel that and that they understand that they're in a place where they can be comfortable, that they can trust the care that they're going to be receiving. And they understand that this is a relationship. This is a long-term relationship that I'm looking to establish with those who entrusted me to care for them.
So a patient who, for whatever reason, feels I need a physical. I haven't had blood work in a long time. I just want to get a picture of how my health is. Is this the place for that person?
100%. So I will be able to draw their labs. We can have a consultation to discuss some of the things that they may have been experiencing, and to come up with a plan that will best be suited for them. And we can track their progress with whether it's weight loss, whether it's immune therapy, with doing different things to help to boost their immune system, or just their overall health and well-being. I will also be able to refer patients if there's anything that's outside of my scope of practice or anything that's outside of my expertise. I definitely will be able to refer them to a provider that will be able to they will be able to benefit more from than here.
So you have the wherewithal to do a complete analysis of one's physical situation and then be able to refer further if necessary. So you're the first stop.
Absolutely. I'm the first stop. And I think that it won't just be a one stop. This will be a stop that they'll come back to over and over again, just because of the relationship that we'll be building along the way and the investment that I will, that I have for my patients that I care for.
It's get healthy and stay healthy.
Your health is our priority.
Ooh, love that. Wonderful. That has to be embroidered somewhere.
Yes, it is. It's all over our flyers. That's our mission statement. That's the idea, and that is our practice here. We want to make sure that everything that's going on, from your mental, your physical, your emotional, your spiritual aspect, because that's what the whole person encompasses. It's not just physical. It's all of the total parts of a person's life and who they are as a human being. That incorporates the essence of who they are and what they need.
I think ideally when physicians go into medicine and practice, that's ideally the kind of presence they would like to have. But then the practice grows and then so many people are waiting online and waiting that some of that personal touch can be lost. And I'm not getting that from you. I'm getting that the personal touch is everything.
The personal touch is everything. And so that is another one of the missions that we strive to and that I strive to make sure that my patients know that they are going to receive personalized individual care when they come into to Olive Branch Wellness Center. They don't have to be concerned about, time constraints. I mean, if, we need to sit down and, if there's something that's heavy on them, if there's something that's concerning that may, be impactful to their overall health and well-being, then we can discuss that. And I want to be able to be a resource to them in terms of different things that they can do and different, venues that they can, different avenues that they can take to help them to resolve those things so that they can live the quality of life that everybody wants to live.
And that they don't know is possible for them necessarily.
Correct.
Do me a quick favor. You touched on holistic.
Yeah.
What does that mean at Olive Branch?
So the holistic approach is going to be a mix between Eastern medicine as well as Western medicine. We're going to be incorporating some IV hydration as well as weight management, as well as, just different components that people don't really understand impact their overall holistic, their well-being. We're going to be, addressing issues of, diet control, hypertension, diabetes, educating the patients on, making healthy lifestyle choices that will be overall beneficial to them as they progress, in the different phases and stages of life. And hopefully they'll be able to take some of the things that they learn here back to their families so that they can then be a champion for health and well-being and holistic living for everyone else.
I'm very excited for you. Really, this is just such a fresh approach that I think most people in the medical community, with the wherewithal to make it happen, would choose to be as expansive as you're being. You have a very personal touch, and this is lovely. I'd like to wander into the treatment room. Walk us through what it would be like for a patient to walk in the door and be treated, what an exam might look like. Okay.
Definitely.
So here we are. We're walking in the door.
PJ
Okay.
walks in.
PJ's here.
Hi, PJ. Welcome to
Hi, Atia.
We're so glad that you chose us to take care of you. We have a lovely reception area that they'll be welcomed. Whatever, paperwork and documents that we need to complete, we'll do that initially. Then we'll invite them to come on in. So come on.
Come on in. Come on. Here we go. Woo-hoo-hoo-hoo. And this is, as soon as Mr. Bowman is able to move the equipment,
Yeah.
there we are. This is, now, Franklin, is this not lovely? This is not your typical clinical medical waiting room or treatment room. This is just lovely. You exhale when you walk into this room.
There's a lot of thought and consideration put into the design of the room. We wanted to make it feel comfortable. We wanted to, make it feel like home, but as well to have all of the different aspects that, things, the equipment that we need to be able to provide the care. So if someone comes in, let's just say they need a physical. So they're going to come in, they're going to get a comprehensive physical, which includes an eye exam, a hearing exam. They'll get on my scale. The eye chart. We'll do that. They'll get on the scale. We'll do we'll do weight, we'll do height, as well as they'll get a blood pressure. We'll review what that may look like. If there's any elevations or if there's anything that's abnormal, we'll address it and we'll talk about it. They'll have a seat on my exam table. We'll do
Very cushy looking.
It is very comfortable. We'll do, a normal physical assessment, which includes, heart, lungs, abdominal assessment. We'll do some musculoskeletal exams. We'll do reflexes, and then we'll just review what that looks like, and some recommendations will be made for, if there is a need for any recommendations in terms of, making sure that they maintain healthy living, healthy lifestyles, and we'll be inviting them back. If there's a need for blood work, I'll be able to draw their blood. We work with 3 different labs, LabCorp, Quest, and AccuReference. So those will be the labs that will be able to analyze their blood work. I will invite them back to review those labs, and then we'll come up with a plan as needed on an as-needed basis.
Wow. I can almost hear the buzzing. Why should I come to you instead of a primary care physician? And what is the difference between what you do as a nurse practitioner and a primary care physician? It sounds like you're cutting through a lot of red tape, but I don't want to misrepresent what you do or what primary care is all about.
Yeah, so I am not a physician, but I am a well-trained nurse practitioner who has the wherewithal, has the training and the skills to be able to manage a as well as the urgent care aspect of things. So if you're looking for the patient that would come here to see me is someone who's looking for a provider that they can trust, a provider that they know is invested in the community. I am a pillar of Franklin. I've been a resident for over 30 years. So I love this community. I am a frequent shopper at ShopRite. So if you see me at ShopRite, if you see me at, your local, the local bakeries, or anywhere in the community, you'll always get the welcoming presence and the welcoming, presentations from me. I'm very passionate about healthcare, and it is my desire to make sure that the people that and within my community have, the resources, that they have the information, the updated information, and accurate information to make healthy decisions and choices that will benefit them, and that will be, in alignment with their beliefs and with the type of care that they aspire and that they desire to have.
But that they don't know is available to them.
But it's available now. It is available
Yes,
now
it is.
at Olive Branch Wellness Center.
There you go. Well, I think that tells the story, Franklin. Again, I was fascinated. I saw the eye chart when we walked into the treat room, and I immediately wanted to sit down in this chair. So
what?
it's just so welcoming.
Would you like to just do a quick...
No, because I'll get very comfortable. We'll do that another time.
You can stay
We'll
all
have
day
tea,
with me,
right?
yes.
So this has just been such a pleasure. Again, College of New Jersey certifications here. There were plants, there were flowers, this beautiful curtains. And I emphasize that, Franklin, not to be surface-minded, but to be welcoming-minded. And when you feel, when you're in an environment where you might be apprehensive in the first place having a health issue or trying to prevent having a health issue, you want to feel soothed. When you walk in a door, feel soothed by the environment, feel soothed by the practitioner. And that's what you're going to find here with Miss Attia.
Yes.
Really, truly, it's been such a pleasure. And tell us again where you're located and what your hours are and how someone would reach you.
Definitely. So we're located at 220 Davison Avenue, Suite 4. So you would come to the 4th floor. We have ample parking that is handicap accessible. We have elevators, so you don't have to worry about that unless you want to take a four steps, 4-story climb up. That's not a problem. It's all about wellness, getting those steps in. We are available for services Monday, Wednesday, and Friday from 9 to 4 p.m. And then on Tuesdays and Thursdays, we're here from 9 a.m. to 7 p.m. We'll have Saturday hours as needed. And we're excited to serve Franklin. We're just excited to serve you, Franklin. So don't hesitate. Come on in. You can give us a call. My phone number here is 732-314-4421. I am on Instagram, Facebook. We have just tons of room. Come on in. Don't hesitate.
Well, we've got the emotional room as well as the physical room,
Absolutely.
and we certainly welcome you to Franklin
Thank
in
you.
this capacity. I mean, you're a
you.
Franklin native, but we
Yes.
welcome you in this brand new environment, in this
Yes.
brand new endeavor. I think you're going to do very, very well.
Thank you.
It's our pleasure.
Thank you.
So, Miss Attia,
Yes.
welcome.
Thank you so much.
This is
Thank you,
PJ Parker, Franklin reporter and advocate. Just so happy to be here. Please come see this woman. She will make a difference in your life.
I'm excited to do so.
And we'll be back.
We'll be-